It's a good morning to you. Welcome to Asake Online. My name is Zinzel Ndebele, and this is the program, the Side View, where we'll be discussing the issues of health and the health sector in Zimbabwe. This program is brought to you by TISDA Zimbabwe Transparency International. Today in the program, I'm joined by Honorable Kombe Josiah, who's the chairperson of the Portfolio Committee on Health. Welcome, Honorable. It's good that we have an MP. It's not always easy to get the honorables, but I'm happy and excited that he has made himself available. We'll also be joined by Dagarai Matanga. He's the senior research officer at TIZ, and we'll be talking about the serious issue of the health sector in Zimbabwe. We've seen so many stories, so many issues online. But to start the program, Honorable, maybe let me thank you for joining us like I've always done, but start by saying, can you explain to us the role of your committee when it comes to the oversight in terms of the health services in Zimbabwe?
So much, Zinzele. Thank you so much for having me. Like you said, it's really a challenge to get time, and that's why I have to, squeeze. I'm parked in a car outside. I'm traveling, and I thought it's important for me to be at this meeting. As you are aware, that Parliament has got three functions. One of it is representative role. The other one is doing oversight role to the executive, which is government, and also to do budgets and other things. And in Parliament, members of Parliament are put into committees so that they can mirror a certain ministry. Like mine, we do oversight role on the Ministry of Health and Childcare. So basically, the committee will be looking at the work of the Ministry of Health and Childcare, hear their concerns, make sure that they deliver as per the promise that they would have given to the public, that this is what they are going to do. Like I said, we do represent the citizens. So when the government of the day goes out for looking for support, obviously they'll be having their manifesto to say, this is what we are going to do. And as a representative of the people, that's one of our works to make sure that they deliver as per their promises. And secondly, we disperse resources as Parliament when it comes to the budgets. We allocate these budgets as per the programs that the ministry would want to do. And we would have to do a follow-up to make sure that the resources that have been appropriated to the ministry, are they putting them to good use and as per the promise and as per the presentation that they would have given to the committee. So basically, this is what we'll be doing. We'll be doing oversight role, making sure that our citizens are getting the services that the executive would have promised them.
Thank you very much for that explanation. Then to you, Dakarai, what I would say, you've been doing this project where you are focusing on the health sector in Zimbabwe. Briefly tell us about the project that you are running.
We are running a project called ISDA, and that acronym stands for Inclusive Service Delivery in Africa, which should sort of give you a clue as to what it's all about. Briefly, this is a project by Transparency International to promote inclusive service delivery in 5 African countries by eliminating corruption, which impacts on women, girls, and groups at risk of discrimination. So the countries that are participating in this project is Zimbabwe, the Democratic Republic of the Congo, Rwanda, Madagascar, and Ghana. So we are collaborating to build a body of evidence on that issue to show the discriminatory impacts of corruption on women, girls, and groups at risk of discrimination.
MP, what would you say is the state of the health system in Zimbabwe currently?
Well, I think at the moment, it's not very good. There are a lot of shortcomings. There are a lot of problems that are associated with our health institutions, especially public institutions. Yes, there are a lot of stories, a lot of news about shortages of essential, things in most of our public hospitals. But as a committee, ordinarily, we do fact-finding visits to most of our hospitals across the country. We might not go to each and every health center, but we do assemble in each and every province or district. We have to make sure that we go and see what is on the ground. When we have completed, we then come up with a report, which we then put into Parliament, debated, come up with resolutions, and also recommendations that we will then give to the ministry to undertake those things. I must say that last year, the committee managed to move around the country in most of the major hospitals, provincial hospitals, and also central hospitals. And what we saw was not good, especially when it comes to infrastructure, when it comes to issues of medicines, shortage of medicines, when it comes to the morale of the workers themselves. There was quite a lot of a plethora of issues that needed to be dealt with. And we then compiled a report which Parliament managed to debate and also offered some recommendations to the ministry so that at least we can try to deal with some of these issues. And I have to say that last month, when the Ministry of Health gave a report with regards to issues of maternal deaths, we also conducted some verification visits to Parirenyatwa Hospital as well as Salim Gabe Hospital, where we were primarily concerned about the maternity wards and also where the kids will be. And I must say that one thing that we realized was that the hospitals were congested. The infrastructure there is not enough to cater for all the people that will be seeking medical health. So we, in a nutshell, we are not where we are supposed to be. There are a lot of things that we need to work on. And that's why Parliament had to come up with a lot of measures to make sure that we improve the service provision that we have in the country. But I must, say it clear that as members of Parliament, we are not happy with our state of health system in the country. A lot needs to be done.
Before I bring in Tagarai, you talked about the state of the health system, and we have had the issues or complaints that there's corruption in the health sector and all those kind of things. In your visits, did you pick up some of those issues?
Well, I think, issues of corruption, they are very difficult to pick just by visiting an institution for just an hour or so. But we have had those kind of allegations, and they've been put before my committee. And what we have done is we've called in the permanent secretary of health, as well as the ministry and their staff to give us an answer to some of these allegations. And, the ministry would say that we are also looking into it. We are also trying to do our own oversight, our own investigations to find out whether these issues are correct or not. They don't need to remain silent. They need either to approach the law enforcement agencies, the police, or get in touch with their member of parliament, not necessarily myself as the chairperson, but any member of parliament within their communities if they see such things taking place. And obviously that message would then come to us. But we need to have evidence. Whenever you have issues of corruption and such kind of allegations, there has to be evidence so that at least those members can be brought to book. But we have also said to the ministry, what you need to do is, even if you have not found anyone, even if you don't have any evidence, what you need to do is to put systems in place, systems that can deter corrupt tendencies. Because wherever it's a free-for-all, when there is no system, it then means anyone can abuse the resources of that institution. So the ministry needs to make sure to come up with systems, be it electronic systems. We are living in the technology. I think it's so easy to put up a system that can monitor, starting from the drugs and everything, so that at the end of the day, we will minimize or deal with issues of corruption once and for all.
Dagara, maybe come in there and say, in your research, what forms of or how does this corruption, manifest itself? What kind of corruption have you identified in your research?
TIZ has been doing research on corruption in the public health sector for some years. We've done research which focuses on Zimbabwe in general, and there are some findings which might also be of interest to you. There are some data sets I can share with you on corruption occurring in Bulawayo in particular. We've conducted research on public health in Zimbabwe in 2020. In general, we did a study to better understand the dynamics of corruption in the health sector. We did this after receiving complaints from the public in the communities we operate during the time of the COVID-19 pandemic. If you recall, there were some high-level corruption scandals which occurred during that time. And also there were some lockdowns where people experienced corruption at facility level and even trying to move around. People had to pay bribes to move around. So we did this study, exploratory study in 2020. And in a nutshell, the forms of corruption which were noted were public procurement, malpractices, there was theft of and sale of essential medicines from public facilities, selling them on the grey market, there was bribery, there was favoritism and false referrals occurring. And then after moving along, after noting complaints from government about huge amounts of money spent on drugs which are missing from the stocks at public health facilities, and also noting ZAC, Zimbabwe Anti-Corruption. So just to, in case you had lost it there, the 2020 study did an overview on the public healthcare sector in general. So we noted public procurement malpractices, the theft and diversion of medicines on the grey market, bribery, favoritism, and false referrals occurring. Then a follow-up corruption risk assessment that we did on the medicines supply chain in Zimbabwe noted two areas of concern. Number one, the evaluation and contracting of suppliers in the area of procurement, where there was a risk of collusion and kickbacks for procurement, especially where there's direct procurement being involved. We saw that as a corruption risk. Then facility inventory management and dispensing of medicines at facility level, where we found that the poorer safeguarding of medicines and falsification of documents were enabling health workers to divert stocks and sell drugs privately at their health facilities. But maybe of interest to you where Bulawayo is concerned, in the first quarter of this year, we did data gathering research on corruption in maternal health care. And if I look at the data from Bulawayo particularly, you could see issues whereby patients are forced to pay bribes to jump queues, e.g. when they are registering pregnancies. Health workers are also forcing patients to buy obstetric supplies and maternal delivery kits, despite us having maternal health care declared for some health facilities. It's supposed to be free. Then these extras which they buy, they are not returned, which makes us suspect that they are being sold back to the public. Then there's also the specter of unnecessary procedures such as cesarean operations, health workers forcing patients to pay for birth records and baby cards. And lastly, patients seem to be referred to facilities where public health officials have an interest, have a financial interest. So this is an overview of the kind of corruption we are seeing in the public healthcare sector.
Honorable, Dagarai has mentioned a lot of issues that could be a worry. I'm not sure whether I picked these when you've gone to your visit, but what do you think the legislators can do to strengthen the legislation around these issues and also protect patients, especially women that are mostly affected in the maternal health centers?
I think first and foremost, what you need to understand is that the legislation is there to deal with corruption. All what Dagara is saying, it's not like these are new things. Parliament, long back, they did put the legislation in place to make sure that we deal with issues of procurement. That's why there is the Procurement Authority of Zimbabwe Plus to deal with those things, to make sure that whichever entity is doing procurement, there are, laws that needs to be followed. So it's not like these are new things. So what is just needed is the enforcement I'm sure that's what is needed, the enforcement from the law enforcement agency. That's why I say that you need also to be having evidence. But as a committee, when we get these kind of issues, and Dagarai from an organization that believes that they did this kind of investigation, I don't think there is a problem for us as a committee to call him before the committee to give us more, so that when we get information, facts that we believe, we can also bring in the Minister of Health to look into some of these allegations, so that at least we can put measures to stop some of these things. Because like what I've said, all what Dagara is saying, you can find out that there is a law to make sure that we deal with this issue. But unfortunately, as you are aware, corruption, we cannot hide. Corruption is there in our country. In each and every sector of our country, there is corruption. But at times you might not know how it's taking place. So you need to have facts, and you need also to take those that are supposed to be putting systems in place to make sure that they protect the resources of the citizens. They provide services that the citizens of this country expect to get from its government. So as members of parliament, I'm sure I will get in touch with Dagarai so that we do our oversight role. We cannot keep quiet when the public are saying there is this kind of corruption taking place at this institution. We need to act as members of parliament. We represent the people, and it is our duty to make sure that we fully take charge of the issues. And as you are aware, we are not the implementers of the policies that we come up with. Is the Ministry of Health. So we'll take the Ministry of Health to say, here is the evidence, here are the issues. Can you go and address? And I'm sure it will go a long way.
Yeah, I like the fact that you said you are going to get in touch with Dagarai. Dagarai, I know the MP is on the road. We don't want to hold him for a while. I can see.
Yes.
We go so that he gets there on time. I'm going to ask you one question so that we allow him to. I will ask him the last question so that he can travel. But my question to you, Dagarai, is: do you engage with these portfolio committees in giving them the issues that you out so that they can lobby? And secondly, if you can answer in the same question, that what institutional gaps have you seen while doing your research?
We try to use all possible platforms of engagement to recommend reforms with the authorities. Just this program we're having now is a very good example where we are also engaging policymakers through CITE. So we try to use every opportunity. When we do these studies, we also approach the relevant ministries to collaborate on the data gathering, as well as also reviewing the findings, the recommendations. Then we also have what we call the policy, legal, and institutional monitoring program, through which we engage these ministries. But where Parliament is concerned, we also engage our local parliament through the local chapter of the African Parliamentary Network Against Corruption, called APNAC. So I'm happy to report again that some parliamentarians are affiliated to APNAC, and there are so many activities that we do together so that they also hear the research findings. As for the institutional gaps, we call them drivers of corruption in the anti-corruption world. And there are a number of things which we can point to which are causing corruption in the healthcare sector. For instance, almost every research we do, people talk about low levels of remuneration for health workers, which is causing them to carry out acts of petty corruption at the point of service delivery. I also note a general moral or ethical deficit which is happening among health workers within their profession, which runs contrary to the values of the Hippocratic Oath, which is a solemn promise traditionally taken by health practitioners to uphold certain ethical standards. And you can see that corruption runs contrary to the Hippocratic Oath. So again, I'm worried about issues of morals and ethics among practitioners, but also citizens' levels of knowledge about their rights. They're unable to demand their rights at the point of service delivery. And when they are also aggrieved, they've got fear to report corruption, and they don't know where to report. So there's also a gap in terms of knowing what to do when you're a victim of corruption. Then also, when we're looking at resources dispersed by central government to the healthcare sector, there are low disbursements, which may cause gaps in the supply of certain implements at facility level. And then this enables individuals to see an opportunity to ask patients for bribes to access medicine, sometimes which are supposed to be free. And then generally lack
Can
supervision and
I,
monitoring
sorry,
processes. Yes.
Can I just hold you there? I want the MP to
Yes.
ask the last question so that he can dash where he's going. Then I can finish it off with
Yes.
you. So probably MP, your last question to you is, what do you think
Sure.
are the long-term reforms that need to be done so that we restore the dignity and trust in the public health sector?
Well, thank you very much. I think before I respond to that last question, let me just say to Dagarai, it is important to engage your parliamentarians, but precisely the Health Portfolio Committee. You know, when we are in Parliament, we all have got different portfolio committees. If you ask me about things to do with ICT, you know, I have no interest, which is that much, because I don't sit in that committee. But if you ask me about issues of health, you know, I've got interest because that's where I was deployed. So it's not just engaging parliamentarians. You need to engage the rightful committees to deal with the issues that you would have come across with, so that they can then take them head on. It's only the portfolio committee on health that can deal with all of these issues. When it's about gaps in terms of policies, that's when probably you then involve the justice, but it will be then probably a combined sitting of this committee so that they will deal with it. So I just want him to feel free to get in touch with the committee. We can engage anyone. It's not an issue of us wanting to invite. You can also write to us to say, I want to come before the portfolio committee because there are issues that I need to discuss with you, and we'll be glad to have you, and we'll discuss about those issues. So I just wanted to make that issue to him before I go. Then the last question that you've asked is that, you know, as government of Zimbabwe, they are failing to provide adequate resources to the health sector. And as you are aware, it's only 10% of our people who are covered by medical aid. And the 90% of our people, they rely on government institutions. And like I said in my opening remarks, to say the situation that we have in our countries is not good at all. We need to do more. And what we are looking at as the portfolio committee is the coming up of the national health insurance, something that has been on the cards for a very long time. We believe that if the national health insurance comes on board, it is going to be a game changer, because resources will now be collected from different areas. It's not an issue whereby people would pay, but it would be like paying on the till. Maybe you are buying a drink, maybe a certain percentage, just like the sugar tax, a certain percentage is collected from there and channeled to the national health insurance scheme. And this then means every Zimbabwean would then be getting medical services that they want. So I think as a portfolio committee, we have been pushing with the Minister of Health to say, please bring in that bill. We want to make sure that we kickstart the national health insurance so that at least our people, our citizens, can get quality service in our country. Furthermore, as you are aware that last year, your parliament came up with the sugar tax, the sin tax, where we said this money will have to go to Minister of Health primarily to deal with issues of NCDs. And what we are now doing is that we have realized that Treasury is not dispensing these monies religiously on time to the Minister of Health so that these machines and drugs can be accessed as soon as possible. So we are now coming up with a motion so that these resources can be ring-fenced, collected, and straight away channeled to Ministry of Health so that at least the impact can be felt there and then. So I'm sure within this second quarter, you would hear that Parliament would have agreed to ring fence, and also not only the sugar tax, but also even the airtime levies, which have been there before. They have been collected. Every data you buy, every score that you make, there is a component that goes to treasury. And we want those resources to be ring-fenced so that they can only be used for health issues. They should not go to the consolidated revenue fund, because the moment they go into the big pot, what it means is that they can be used for anything, and yet to then have a gap in our health sector. So I'm sure long term we have this national insurance policy, but immediately we want to ring fence our taxes so that they are collected religiously and go to a means of health. Just the same way we do with AIDS levy. It's collected from the employees and employers and goes to National AIDS Council. It does not go to Ministry of Finance. So that's exactly what we want to do, so that at least there is resources. Because we are not happy with the disbursement coming from Treasury.
Thanks for the MP for joining us and highlighting some of the issues and talking about the fact that they are aware of the issues that are facing the health sector. And of course, it's not every day that we get the MPs or the members of parliament to be with us. So we really appreciate him taking his time. And like he said, he's on the road, so he has proceeded to wherever he's going. But Dagarai, I want to come back to you, and maybe like before the MP came in, I interrupted you when you were talking about some of the issues that you have seen, the gaps that you have seen. You were talking about procurement, you're talking about the corruption in the health sector. But are communities empowered to demand accountability when it comes to issues of corruption, or they're afraid of reprisals?
There is information asymmetry where citizens are not given the full details of health programs or their entitlements at facility level. So on one hand, you're reading in the paper, we've got free maternal health care, but that is not the experience you are getting when you get at facility level. So there's a disempowerment which is caused by a lack of information and general lack of awareness of rights and entitlements. That's one of the challenges. So that even when one is affected by corruption, they also don't know where to go and report. And there are some challenges again with the reporting mechanisms at facility level. Like in our research, we found out that there are suggestion boxes at the health facilities, but these suggestion boxes are opened by the staff at the same facilities. So I think the impact of those suggestion boxes is rather suspect. So it's a lack of information. It is a fear of reporting, but even if there's a mechanism of reporting, I think we could do better in the way we orient these reporting mechanisms.
Yeah, the interesting part about Zimbabwe is that when we have problems, we introduce, instead of solving what we have, we introduce another levy and another avenue for looting. The MP talked about their thinking of the national health scheme. That's another scheme for people to pay more when they're already. We have the sugar tax, we have the time tax, we have so many levies, the AIDS levy. So this money is not enough now that they're thinking of introducing yet another tax in form of the national health tax.
I think one analysis which needs to be done before another levy is introduced to see whether the current levies have been optimized. We've been talking in the last hour about corruption, which generally diverts public resources into private pockets. So instead of loading the fiscus again with another levy, let us fix the current systems by making sure that what is collected right now and what is spent is used optimally. That's what I think about that particular recommendation. Nothing wrong with raising taxes, but there must not be another avenue for some people to make money from public resources.
Yeah, my last question to you will be, we might be having people who are, facing corruption and all those kind of things, and they would like to engage with you. How do you engage with stakeholders? How do you help them report corruption? What can they do?
So we've got various structures around the country, which we call accountability monitoring committees. So these are structures at the grassroots level, which we empower with social accountability tools, and they monitor corruption at community level. So we've got those structures. But if people want to also get in touch with us, we've got a WhatsApp number, 0781 432 521, where they can also speak to us. But over and above that, I also encourage people to report to the competent authorities. The Zimbabwe Anti-Corruption Commission has got toll-free lines. The toll-free number is 0800-4367. But they also have got a WhatsApp number, 0719-529-483, where they can report incidents of corruption.
Thank you very much, Dagarai Matanga, Senior Researcher at TIZ, for joining us. We also had Honorable Makombe Josiah, who is the chairperson of the Portfolio Committee on Health, and we were looking at the issues of the health system in Zimbabwe, how women and the other marginalized groups are affected by the health system, looking at the corruption that is there. You know, people are asked to pay lots of monies for this and that, but also the poor state of the health sector in Zimbabwe. I know you might be having other issues that you want to talk about in terms of the health. Please feel free to get in touch with us at CITE. We are found on all social media platforms, Facebook, Twitter, WhatsApp, YouTube, CITE ZW. This is the program which was brought to you by TIZ Zimbabwe, International Transparency International Zimbabwe, in partnership with CITE. My name is Zenzel Ndebele. Let's meet again in other programs.